Now, the National Institute for Communicable Diseases recently announced an unexpected and steady increase in mumps. And this, of course, an acute viral infection caused by the rubulavirus, also known as the mumps virus. And cluster outbreaks have been noted in different provinces, with KwaZulu-Natal, Gauteng and Mpumalanga accounting for the majority of the outbreaks. The Department of Health has urged the public not to panic over the outbreaks, which mostly affect children between the ages of 5 to 9 years old. However, younger and older children as well as adults can become infected. So to give us an update, we're joined by Dr Michelle Groome, who's head of the Division for Public Health Surveillance and Response at the National Institute for Communicable Diseases. Dr Groome, thanks so much for your time. Welcome to Morning Live.
Good morning to you and to the viewers.
So the outbreak of mumps was announced last week by the NICD. Have you seen any further increases since then, Dr. Groome?
Yeah, so mumps, unlike measles, it's not a notifiable medical condition, and we don't have kind of a specific surveillance program for mumps. So I think what happened from about February this year is we started having some reports from the provinces who were phoning in on our call clinician line to say that had been seen increasing cases in mumps. So we had actually gone back to look at data from the public sector for testing for mumps and had looked at this last few months in comparison to previous years. And I see you've brought up the slide there nicely, thank you. And so you can see this year we have seen increased reports of mumps, so there was increased testing for mumps. And the total number of positives out of the number of tests has been higher than we've seen previously. But because it's not notifiable and we don't have active surveillance, it's quite difficult to look in real time at what's happening to the mumps cases. So if you remember with measles is notifiable. So every doctor who suspects measles clinically has to notify us through the notifiable medical conditions. There's an app. But for mumps, we don't have that same level of surveillance. And this is mainly because mumps is usually a disease that settles on its own. It doesn't have all the serious complications associated with measles. That being said, we are monitoring the mumps. We are having a look, continue to look at the number of tests that are being performed. And you can see in terms of the age groups, really it is in those under 10 years of age. So it's mainly the younger children, although we do see some increases in some of the older age groups.
So, Dr. Groome, just in terms of how many cases of infection constitutes an outbreak, can you just talk to us about that, just also to give a sense of the prevalence at this point?
Yeah, so we really, for mumps, there's nothing specific. I think really an outbreak is an unusual increasing number of cases compared to the baseline. And so that's what really led us to declare an outbreak, because we'd had a look at the baseline, what was happening before this, and we've seen an increase in the number of cases in this year. And also we look at the percent positivity. So remember from COVID, percent positivity is the number of positives out of the total number of tests that have been done. And so we will be able to look at the number of tests that were done and then look at the number that were positive. And so, I mean, from the graph, you can definitely see that there has been an increase, especially in provinces that we haven't really seen this before. If we compared to last year, KZN, Mpumalanga, and Gauteng seen those increases. I think it's also quite difficult coming out of the COVID-19 pandemic. Over the last 3 years, we have seen decreased circulation in a lot of viral infections. Mumps is also spread by respiratory droplets, and so if you have lockdowns and wearing of masks and decreased contact between people, you're also going to have decreased spread of these other respiratory or other diseases spread by respiratory means. And so what we've seen with measles, now with mumps, we are seeing many increases in other viral infections which weren't spreading during the COVID-19 period. So while it's unexpected, I think, we do expect increases in these viral infections because we haven't had a lot of transmission over the past years.
And just touching on COVID-19 there, Dr. Groome, Leanne and I were just having a conversation off air about what's going on with the seemingly increased number of flu cases being reported in certain schools and areas. With regard to tracking COVID-19 and, how is that going? And is there possible increase in the numbers of what you can see there?
Yeah, so we continue to track the COVID-19 cases and hospitalizations. So you'll know that the WHO declared an end to the pandemic. It's no longer a public health emergency of international concern. But we continue to track these cases. We have sentinel surveillance through our notifiable medical conditions surveillance system. We are tracking the hospitalizations. So we know that there is still circulation of COVID. It's not going to go away, although we aren't seeing the severe disease, the hospitalizations and deaths that we were seeing previously. So there is COVID still circulating. Please remember it's also the influenza season. So I think when people talk about flu, they use it quite generically in terms of any kind of fever, cough, sore throat. But influenza, there's a lot of influenza. There have been a few influenza outbreaks or increased influenza cases in some of the schools. So please to remember that it may not all be COVID, may well be influenza or another respiratory infection. We're heading into winter, and I think all respiratory infections will be managed in a similar way. And so really, if you are sick, to remain at home. If you're coughing or sneezing, to please just cough into a tissue. And really, if you are feeling any severe symptoms, shortness of breath, you feel like you're not getting better, please to go and see your healthcare worker.
And just getting back to the mumps outbreak, Dr. Groome. Okay. So the symptoms, that present themselves and the sort of interventions that can be made, including possible immunization or booster immunization. Let's talk to that, please.
Sure. So mumps presents very much like other viral infections initially, with fever, feeling tired, body aches, and then actually presents with swelling of the salivary glands. So this is usually the parotid gland. So there'll be swelling of the sides of the face. And just to remember that quite a lot of mumps may be asymptomatic. So you may have mumps without having any symptoms. And so they usually have swelling for about 5 days of the salivary glands is quite painful. And then this will resolve generally on its own. In the rare cases, there may be some complications, but in general, symptomatic treatment, so you will treat the pain, treat the fever. If you're worried that you don't seem to be getting better, please to consult your doctor. There is South Africa, there is a vaccine available for mumps, but we are not using it in the public sector in South Africa. It's not in our expanded program of immunization. You are able to get the MMR vaccine, which is measles, mumps, and rubella in the private sector, but we do not have this vaccine available in the public sector. So at this stage, I think it really would be symptomatic treatment. And so, we don't have a vaccine available at the moment in South Africa.
So, Dr. Groome, people who've had mumps are usually protected, please correct me if I'm wrong, for life against, another mumps infection, or that should be the case. However, if a second occurrence does happen, what should be done? Is it usually for a specific reason, and how common is that actually?
Yeah, so it's quite, mumps and many of the viral infections do provide, of the childhood viral infections do provide long life immunity. In rare cases, you may get a second episode of mumps. It's quite difficult to know if it is the first or second episode. Some mumps is asymptomatic, as we said, so you may not even have known you had mumps. But I think it's quite rare that if you've been exposed and developed immunity, that you would get a second infection, and it's unlikely that it's going to be more severe than your first infection. So I think most infections will give you lifelong immunity, and so there's no real reason to suspect that a reinfection with mumps Sometimes in people that don't have good immune systems, you may not have generated that the antibodies to your initial infection, in which case you may get a reinfection. But I think, safe to say that the vast majority are going to develop immunity to a mumps infection, and then you would be protected, in coming years.
And just finally, Dr. Groome, as we wrap this up, your data showed that the annual positivity for mumps had previously peaked at 39% in 2019. However, if we look at the percentage positivity for 2023, from the data that is available, that is at 69%. Now, is this the highest? And also, what can we attribute that to? Is it just because of, the sort of protections that we saw during COVID, or is there more to it?
No, so remember the positivity. So what that means, it's the number of positive tests, or the positive tests out of the total number of tests done. And because we're not monitoring mumps as part of our notifiable medical condition system, I think it's quite difficult to try and read too much into it, because the testing, as we saw with COVID, as soon as there was a lot of COVID around, the number of tests would increase. And so it's very similar when clinicians are aware of mumps, there may be increasing testing of mumps as well. So I think this does show that there's a lot of more tests being done, and of those tests, more are positive. Some of that could just be more awareness. So if patients are coming in to see their doctors are now more aware that there may be mumps. There definitely is more mumps in circulation. So I think it is one metric that we can use to monitor, and I think we will keep an eye on that. But I think at the moment, there are increasing cases. Clinicians should be aware. I think for the general population, just to be aware that the mumps is circulating, and that it would be mostly symptomatic treatment.